Welcome to the Spark Standards in Action Showcase, where active Spark community implementers share their perspectives, experiences, and example implementations of some of the fire implementation guides designed by the Spark community. Here we will have community representatives showing the art of what's possible using the community design specifications to enable safer, more connected, and more efficient healthcare. I'm your host, Michael Hosking, Deputy Lead for Community and Engagement for Sparked. For this showcase, we'll jump straight into the discussion. For a background on Sparked, what it is, our goals and related resources, please visit sparked.csiro.au. Today we're joined by Marvin from Telstra Health. Marvin Malcolm is a lead architect at Telstra Health and co-chair of the Spark Technical Design Group, where he helps shape national fire implementation guides like AU Core and the Australian Patient Summary. With over 10 years of experience in health and HL7 Fire Advanced Certification, he specialises in designing scalable, standards-based digital health solutions. Thanks for joining us and sharing your experiences, and also a demo which we're excited to see.
It's good to be here. Thank you very much.
First question, Marvin. What are your current challenges of health information sharing in Australia?
Well, if I think of Telstra Health, we, as many people know, we are a collection of, our history has been a collection of multiple organizations that were purchased, brought together, and operate in different healthcare verticals. So we've got primary care, community care, hospital care, aged care, population health, pharmacy. So we kind of have that broad spectrum. And as you can imagine, bringing all of those together, each one was running their own separate business at the time. So when you brought them all together, all the data is siloed. All the data is kept separate. So even though you may have an individual that has touch points in multiple areas of that, the information for that particular individual, consumer, patient, depending on the scenario that you're looking at, that was maintained in those systems. And then sharing that information across was hard work. When we went to implement solutions for clients, we would roll in, install our software, and then they would start the task of having to integrate with 20 other systems. And so you've got that, how do we do that? How do we do that in a safe, secure, and I guess time expedient way, because we don't want to be doing this forever. You really need to get the implementation done quite quickly. So you had those, if you imagine all of those situations together, and Telstra Health is no different from the broader ecosystem. In some ways, it's a kind of a microcosm of the broader thing, a small reflection of what's going on more broadly. And so if you imagine you've got allied health, you've got community, you've got pharmacy, you've got hospitals, you've got aged care, all of these groups together, all are involved in the continuum of care of an individual. And the question is how do we allow each of those different verticals to have the right information at the right time to be able to provide the best care for an individual? So I think that for me is the crux of the challenge, is that how do you get the best outcome from the patient, given that you've got all of these silos with data about that patient? And it's solving those problems, I think, that's the real challenge, because if we can get to that point where you have that full longitudinal record of a patient, which shows all of their interactions with different health providers, with consent, of course, kind of baked into that. I think if you can get that, then you start to get that holistic view of the patient. And now you can start to make informed and intelligent decisions for that individual. So I think, to me, that's the current challenge. And that's what we're trying to solve now.
Yeah, it's a very complex ecosystem, isn't it?
I think so. Well, it's an understatement to say it's a complex ecosystem. It's a very challenging ecosystem, and compounded by the fact that you've got a lot of old systems. So systems have been running for 20 plus years, 30 years even. If they were all brand new systems that people were developing now, you could kind of build in some of those capabilities. But given that these systems, legacy systems with a lot of information, a lot of valuable information, but not so easy to get out and not so easy to share, that kind of compounds a problem as well.
Absolutely. There's a lot of challenges there. And what problem does Spark solve?
Well, we have for many years said that one of the things we need to do is we need to solve this interoperability challenge. And we've been talking about it for years, and it's clearly one of the things that we need to have a checkbox on and make happen. But it was hard to make it happen because every organization has their own timelines, their own priorities that they need to put together. Therefore, getting together is just hard work, and it's not because there isn't really a will, but there's no one coordinating it. There's no one saying, okay, well, let's get together on this date to solve this particular problem. It's hard to, if you imagine, we've got hundreds of organizations in Australia solving healthcare problems. How do you bring them together? One person from one organization is not going to be able to do it. That's more than a full-time job. So I think one of the things that Sparked has done is it's been the vehicle for making that happen, which I think is what, I don't underestimate the effort, but I think it's one of the real catalysts, one of the really important parts of the Spark program is that it has been there. It's a bit like if you think of I forget the chap's name who wrote the book, The Tipping Point, and one of the things he has in there is you have this concept of connectors, these people who are the ones that connect and bring other people together. And for me, Spark is that connector. It's the thing that we've used to be able to get all of these organizations together so that we can start to affect change.
Absolutely. Well said. And why is Telstra Health involved?
Oh, for us, it's quite simple because we need to put the patient at the center. And if we are going to make it valuable for the patient, then we need to do that in collaboration with other people. We are not the only healthcare organization in Australia. We absolutely must work with all the other organizations in order to make this happen, because otherwise we're doing the customer a disservice. So, the consumer is our customer, the consumer, the patient, the resident, whichever, however you want to call them, depending on your different scenario. They're the most important thing, and they're the ones that we are ultimately doing this for, because if it works for them, then it's what makes healthcare function.
Absolutely. And in terms of these Sparked Fire implementation guides, which ones are you implementing?
So we are working with 3 of them at the moment. So AU Core, AU e-requesting are the ones that are probably more advanced. We're certainly working with the AU e-requesting to start to work out how from our primary care solutions we can do electronic orders with pathology labs. I guess underpinning both of those is AU Core. So, for example, with our Helix platform, which has mechanisms to, I guess, pull in smart and fire apps. One of the things we've done is made sure that AU Core is the foundation underneath that for our fire server, so that we can be sure that any smart app that we get, as long as that's conformant to AU Core, when it comes to query our system, it'll be able to pull the information out and be able to understand that information. So AU Core is, I guess, the core of things, excuse the pun. But e-requesting is the one that's probably more advanced. The one that we're just starting to work on now is patient summary, and looking at primarily from an aged care perspective as to how we would use or share a resident's information with third-party systems, and using the AU Core, AU Patient Summary as the vehicle to do that. Because if you think about it, when a patient has a patient transfer, or someone is looking at a patient to work out, well, does this patient need to go to hospital? We need to provide them with a summary of that patient's data. And we look at patient summary as probably an ideal vehicle for doing that.
Oh, great. And for the demo that you're going to show us, which fire implementation guides will be showcased?
So we talk about all three in the demo. So we talk about, we start off with e-requesting. We look at AU Core in the context of the demo of smart apps. And then we talk about what we're doing or planning to do with the aged care summary, patient summary work.
Oh, fantastic. Well, let's get into it and see what it looks like in action.
Thank you for the opportunity to share the impact that the Sparked Accelerator has had on our solutions at Telstra Health. Telstra Health solutions support a broad range of healthcare settings, from primary and aged care to pharmacy, hospitals, virtual care, and population health. But as anyone in healthcare knows, no system exists in isolation. Every system holds a piece of the patient story, and it's only by sharing those pieces that we can deliver truly connected care. Traditionally, every new implementation involves costly bespoke integrations, and you've probably heard the old saying, if you've seen one HL7 message, you've seen one HL7 message. And that's why Telstra Health sees FHIR as a real opportunity. But it's only an opportunity if we adopt it in collaboration with other solutions in the ecosystem. Without standardization, we risk repeating the same fragmentation that we saw with HL7 version 2. And this is where the Sparked Fire Accelerator comes in. Not just a set of technical standards, but a national community of government, providers, clinicians, peak bodies, and vendors like ourselves working together to define a template for building interoperable solutions. And we think this is important because ultimately, the value of Sparked is about delivering what matters most: better care for patients. It allows people to tell their story once and have it follow them across their multiple care journeys. It allows them to receive the best care, which is supported by both timely and complete clinical information. Let's take a look at how Telstra Health has been adopting the Sparked Fire Accelerator in its solutions. Our first example of information exchange is the common GP visit that results in a blood test referral. Today, this process is often paper-based or relies on custom integrations tied to a single pathology provider. Now, as a patient, I have been known to leave the clinic with a printed form. I head home, I put the form down, and after a few weeks, sometimes months, I've forgotten what I've done with that form. And typically, I'll have to call the GP practice and say, can you send me a replacement form, please? The AUE requesting standard starts putting in the key building blocks and putting those in place to improve on that experience. It defines how GPs can send electronic pathology requests directly to a nominated lab, a process known as an assigned order, and allowing them to retrieve the request electronically, automatically loading it into their system, which both reduces administrative effort and eliminates errors often due to mistakes made during manual re-entry. It's the first small step in a longer journey, but it has big implications for both clinical safety and efficiency. The diagram you can see on the screen describes the flow. The Smart Connect widget, which is part of Telstra Health's Smart Connected Care Suite, extends Medical Director Clinical, enabling a fire service request to be generated for the order. This is then sent to our Health Information Exchange and made available to downstream laboratories. I'd just like to run through a quick demo of how we've incorporated electronic ordering using the AUE requesting standard in Medical Director Clinical. In this demonstration, I'm using the non-production samples database. So picture a consultation with a patient named Angelina Clements. As the appointment progresses, her doctor decides it would be appropriate to order a blood test for further investigation. So she launches the pathology request portal and requests a couple of blood tests as she would normally do. For our demonstration, let's select an iron study, which we can search for manually and add that to the list. and also a thyroid hormone test. Now, on clicking print, the doctor is presented with a new dialog which allows her to create the digital order. We can see that all the information is pre-filled, such as the patient's demographics and the tests we've just selected. And the doctor has the option of making modifications to that, such as adding a new test, selecting the lab that the request is to be sent to, or maybe just adding a comment. In our case, no further changes are required, and she can electronically sign and submit the order. And really, that's all that there is to it. The order is added to the clinical record with a minimal change to the GP's existing workflow. The request is sent to Telstra Health's HIE using the AUE requesting standard, and it's now available for the pathology lab to retrieve and ingest it into their lab information system. This work is still in progress. We're currently engaging with both public and private pathology providers to deliver a solution that fully aligns with the AUE requesting standard for assigned orders. And we've recently begun the discovery work for diagnostic imaging. We are looking forward to collaborating with the community on priorities like subscription notifications, unassigned orders that can be retrieved by any participating lab, and ultimately, we'd love to get to the place where we have consumer-held orders that are accessible via QR code on their phone, giving patients both choice and convenience while still ensuring the safe and efficient processing of the order. In the aged care space, we've just started a journey with patient summaries. When a resident requires urgent medical attention, it would be nice if clinicians that are outside of the residential aged care facility were able to assess the urgency of their care based on their most recent clinical information. This information, along with their historical record, can be used to triage their case, potentially by telehealth, to determine if a visit to the emergency department is required. We are looking at exposing this information as an AU patient summary that external clinical teams can retrieve into their existing systems to support residents and aged care providers. Every day, clinical teams capture information about patients, residents, or participants in wellbeing programs. Yet often, the same information is recorded in slightly different ways across different systems, making it harder to compare or interpret results consistently. This lack of standardization creates barriers to delivering coordinated care and limits the usefulness of data in improving health outcomes. Smart on Fire apps offer a powerful interoperable solution. They are built on open healthcare standards and run seamlessly within the context of a clinical system, enabling consistent data capture, up-to-date clinical decision support, and easier adoption of evolving best practices. Our Helix practice management system natively supports Smart on Fire apps through its integration with Smile CDR, a leading Fire platform from our partner Smile Digital Health. We've adopted the AU Core standard for Helix integration to ensure it meets the requirements of nationally developed assessment forms and their corresponding clinical decision support tools. We're in the discovery phase to determine how we include a similar capability inside our medical director clinical and communicare products, which will increase the availability of nationally developed assessment tools to health providers that use our products. We're looking forward to continuing our collaboration with the Spark community as we make good on our mission to realize a connected and improved digital health experience for all. Thank you.
All right, that was a fantastic demo to see how these actually work in practice. So thanks very much for that. And it's really exciting to see the potential of what's possible in the future. So why should others get involved in Sparked?
I think people should get involved with Sparked because it allows us to provide, as I mentioned earlier, the best outcome for the patient. So if you're involved with patient care in any way, shape, or form, then we as Telstra Health would love you to be part of it, so that, you know, when we have our touch points with you, one, it's a lot easier to make happen because everybody's doing things in the same way, in a standardized way. But we also can start to pull in information from all the other parts of the ecosystem. You know, one of the areas that when we started with the Sparked program, allied health weren't a big player in that back in the day. But I think it's really great to see that the allied health care teams are now part of Sparked. And I think that's really important because holistic care, it's not just about when you turn up at an emergency department. Health care is really around the whole well-being of an individual, and that means it's preventative care as well. So all of these things coming together, and then when you are unfortunate enough to have to go into a clinical care facility like an emergency department, or you end up in hospital in acute care, they can look at all the other things that are going on with you and say, okay, we can see that you've been doing a really good job with this. Maybe we need to refer you to another part of the ecosystem to say, okay, well, maybe we need to look at diet over here, or maybe we need to look at some other aspect of your health and well-being in order to make that work. So it's getting that cross-pollination of somebody's information to maybe spark something that will trigger some, you know what, that's something that we haven't seen. And maybe that's something that can be involved, maybe not involved, but something that can be looked at in order to improve someone's care. So I think the more people that are participating, the more a patient has a chance of having everybody understand and have the right data.
That's absolutely right. We want all the right data in the right time at the right place to treat the people with high quality data. So absolutely well said. Yeah. And any final parting words in terms of one key insight for adopting national fire standards?
I think if I was to say one thing, it would be just get started. Just get on that journey, because it can look like it's a real challenge, or there's a lot in front of you. You may turn up at a Sparked meeting, for example, and people are talking about things. You think, my word, I don't understand half of this. That's okay. It's about being involved and being part of the community, because once you are involved, then things will start to click. You'll start to understand, all right, okay, I understand that we need to do this, we need to look at that. I understand that in order to ensure that we've got connectivity, or we can have interoperability, maybe I need to turn up at a connectathon. And the connectathons are events that are incredibly welcoming for people. No matter where you are on your journey, if you turn up at a connectathon, there'll be people there who will be able to help you, support you, give you some guidance, share information with you. So I think it's just about starting. There's a lot of people in the community who are just willing to help. And that's something that I've found. They've been very welcoming, and it's just a journey we're all on. We're not all at the same place, but as long as we get started, I think we can make a real big difference.
Absolutely. And I think that's something that I really enjoy about our communities. It's a very inclusive and open community for anyone of any backgrounds. And thanks very much for that, Malcolm. That was really, really, I really appreciate your time. I just wanted to, I guess, say that everything that you do as part of your contributions to the community are really appreciated, and everybody who puts in time and effort into developing the standards, it's a very worthy cause. And if you here listening are interested in participating in Sparked, we've included a QR code which will take you directly to registering, and you can register based on your interests, whether you're clinical, technical, or a bit of both. And also, please feel free to jump onto the website to explore and have a poke around and look at what we're doing. We also have a Sparked podcast. We've got season 1 out. That's if you're interested. And we're also working on season 2. And we share a lot of information and updates on our LinkedIn page as well. So give us a follow. And lastly, if you do have any questions, you can email us at sparked@csiro.au. Thanks very much. And thanks, Malcolm, for joining.
Thank you for having me.